Hello guys, well, welcome to Just Women Africa. My name is Olalekon Amusa, and do not forget to hit the subscribe button, leave a comment and tell a friend about Just Women Africa. Today we're shooting outside Tema. It's actually our first time shooting outside Accra. We're actually in Tema. Tema is about 45 minutes from the Kotoka International Airport. In Tema we have the Tema Oil Refinery, where a lot of the refinery goes on for cars and for the airplanes, petrol, for the economy. We also have the Tema Harbour, where a lot of import and export goes on. In Tema, Tema has approximately 200,000 people, which is made up of various groups of society where professionals stay. Because of Tema has a lot of industries around, people tend to stay a lot in Tema. And in Tema, we have a hospital called what?
Healthwise Medical Center, located in Community 1 Tema.
Yes, so we're in Community 1 at Healthwise. And Healthwise is being run by a woman. The CEO is a woman. So we're going to be talking to her about Healthwise, how they got started. We'll talk about the healthcare challenges. We'll talk about COVID and what's up for the future. All right, so you're welcome to the show.
Thank you very much.
All right, so tell us about yourself.
So my name is Dr. Jean Yankson. I am an occupational health physician and the CEO of Healthwise Medical Center. I actually grew up in Cape Coast, which is in the central region of Ghana, and that's where I had my basic level education. I also had my secondary education in Cape Coast at Wesley Girls High School. And then from there, I moved to the Ashanti region, in Kumasi to be precise, where I attended the Kwame Nkrumah University of Science and Technology. I did my bachelor's there in human biology, as well as medicine and surgery. And then from Kwame Nkrumah University of Science and Technology, I proceeded to Cardiff University in the UK. And that's where I did a master's in occupational health. From there to the Norwegian Institute of Maritime Medicine. And that's where I did a diploma in petroleum medicine. So this is where all the occupational health channels in. I am also a mom of two. I'm a wife.
Okay.
I'm Christian and I identify as a medical entrepreneur. So that's a little bit about me.
Wow, okay, that's interesting. What is petroleum? I'm sure viewers will hear that and wonder what?
Petroleum medicine. So you know how in medicine we have a specialty for everything.
Exactly.
When you're a child, your doctor is a pediatrician.
Exactly.
When you are a pregnant woman, your doctor is the obstetrician.
Okay.
So workers have a doctor who is the occupational health physician.
Okay.
And workers in the petroleum industry, those who work both offshore and onshore, also have a doctor who is the petroleum doctor.
Oh, okay, that's interesting. I never knew that. I never heard of that. That's the first time I'm hearing of it. Okay, so let's talk about Healthwise. How did you end up being a CEO of Healthwise? I mean, how did you?
Right. So let's say my journey has been pretty interesting. I actually started out in the public sector.
Okay.
And while I was there, you know, I was faced with a whole lot of challenges that the public sector has in Ghana. Okay. And I felt like I wasn't able to make change.
Okay.
I felt like I wasn't the change maker in my facility.
Okay.
And I wanted to create a system where I would be the change maker and practice the kind of medicine that I feel Ghanaians deserve.
Okay.
And so to do that, you have to learn.
Yeah.
And the best way to learn is to learn from a system that you want to emulate. And so I worked for an international healthcare organization. And at that point, I was actually living and working in a mine in Ghana.
Okay.
While I was there, I learned how things are done in that system. And then from there on, I decided that I would love to set up my own facility. It was time. And basically managed to convince my better half to get on board with me, got investors on board, and set up the facility. So the dream became a reality. So that's how I became CEO of Healthwise.
Wow. So you manage your other half? to come on board. How did you manage to do that? Because that's really interesting. That's really, how did you manage to do that? That's the power of a woman. How did you get to do that?
The power of female persuasion. Well, it was multiple factors. Yes, there's the power of female persuasion, but you also have to be scientific about how you want things done. So when you have a dream, you put it down in terms of a business proposal and you present it. Doesn't matter that he's your better half. You present the proposal to him and convince him of the validity of the proposal. So that's how we got there.
How long did it take him to come to?
About a month.
A month?
Yeah.
Wow, he must be very persuasive. That's interesting. So he quit his full-time job to join you?
Oh yes, he had a great job actually, and I think that was the biggest challenge, you know, how to move from a great job into the hope of a better job. But you know, he got on board and he quit his job. He actually started the facility, the construction era of the facility without me.
Okay.
And I got on board after the construction had been done. So we're a good team.
A good team. Oh, that's nice. So how long have you guys been running here for?
So we are in our 6th year at the moment.
6th year?
Yes.
Okay. So starting off a health facility, what have been some of your challenges?
So like every typical startup, biggest challenge is usually financing, how to secure financing. And how to maintain it, because you know, for the first 5 years of a startup, you need to have some form of capital in there to keep it going. But thankfully, we managed to, you know, make inroads with that. We are not there yet. We would appreciate more financial support, but we managed to get the basic initial financing. So that was the biggest challenge in the first place. I think another challenge that we had was in terms of getting the right material to work with.
Staffing, you mean?
Staffing, recruiting. A lot of people are used to the typical way of working in public sector in Ghana. And so in the private sector, when you recruit, it goes beyond the person's proficiency as a professional. You actually need to train to get the person to buy into your vision and execute. So staffing was another huge challenge. On the personal front, having a startup with a young family is very tricky.
Okay.
You know, I delivered my children while running a hospital. So that means you would carry your pregnancy and be walking up and down and managing things, you know, in a startup phase. I'll tell you a sad story. I actually lost my first pregnancy in the course of, you know, setting up this hospital.
Oh, I'm sorry to hear about that.
Yeah, and I say this because there are a lot of women out there who have been through a similar situation and find it difficult to talk about and difficult to overcome. So, you know, I was pregnant and I was walking up and down. I was inspecting a clinic in the quarry that I was setting up for Healthwise. I was all over the place, and unfortunately, you know, baby didn't make it. But after that, I've had my other 2 children while running Healthwise, and you have to be a good wife, be a good mom, and be the CEO.
So will you say the loss of the baby was because of the stress in setting up a hospital and work at the same time, or it was just one of those issues of just lost a woman losing a baby?
I would say that, you know, having a miscarriage or having what in the medical terms we call it having an abortion in the first 3 months of your pregnancy is something that is pretty common. However, there are things that you can do to exacerbate the process. And I would say that gallivanting up and down a quarry probably didn't help me much, you know. But it was a stressful period, you know, very stressful period, very intense, and, you know, it would have contributed to the situation. Yeah.
Okay. Sorry about your baby.
No.
Okay. So tell us about Healthwise. How many beds do you guys have here?
So Healthwise is actually a 20-bed capacity hospital.
Okay.
We also have a theater, emergency room, and a delivery suite.
Okay.
It was set up initially as an occupational health hospital.
Okay.
However, over time, all other specialties have come on board, and we also offer general health care.
Okay.
For the occupational health aspect, in addition to this hospital, we also run 5 other company-side clinics, and they are in various industries.
Okay.
In the construction industry, power manufacturing, and oil and gas industry. So we have capacity to basically come to your worksite, set up a clinic, and run it for you.
Okay.
And we liaise with a lot of, health and safety officers, HR officers, to take care of employee health. Occupational health is very, let's say, very limited in Ghana. Most people identify with general health care and, other specialist health care. But in Tema is an industrial hub. And in Tema, occupational health is very important. So it was initially set up to tend to that need. However, we also do obs and gynae, we do pediatrics, orthopedic surgeries, plastic surgeries. We are very well known for our hand surgeries. In Tema, the manufacturing industry tends to have a lot of hand injuries, work-related accidents, and Healthwise is known to manage such cases. So we cut across. We have eye care, home health care. We have patients at home, and we have nurses who tend to them as well. We have a myriad of things, laboratory services, COVID-19 testing, various departments. So even as much as we are set up like a typical hospital, we can work both in our hospital and outside our hospital.
Okay. It's funny enough you mentioned COVID-19. Do you think COVID-19 is a game changer in terms of healthcare in Ghana?
Ooh, that's
in terms of, has it exposed the shortfalls in the health system?
Tell you what, I think COVID-19 has done, a big disservice to the world in general, but it has also given us opportunities to get things right.
Okay.
So when COVID started, everybody panicked because we realized we are not prepared. We all knew the healthcare system in Ghana wasn't the best, but COVID really exposed it, let me use Donald Trump's word, bigly. We suddenly realized that we need to do things very, very differently in terms of even how we talk to our patients. When you go to a hospital, typically the first question we ask wouldn't be, have you traveled in the last 2 weeks? But because of COVID-19, it's now our first question. So it's changed how we communicate. I remember Kolebu, the dental clinic had to be suspended for about a week. We were afraid to examine people's mouths because we are afraid to get infected, So over time, we've had to adapt and we've had to change how we communicate and how we examine our patients. And so it also, even as much as it gave us the opportunity to adapt and it exposed the things like, we don't have PPEs, we don't have equipment, but we learned to improvise. And so I think that it gave us a great opportunity. It also helped us to see how benevolent Ghanaians are. Corporate society came in and started doing these donations and, building that infectious disease center. Unfortunately, almost all of it went to the public health sector. Very little came to the private sector. But we play a great role in, ensuring that Ghanaians get health care. And so there's an opportunity to actually ask that, the corporate institutions also support the private sector to, equip us and help us to be on board in terms of managing COVID well for Ghanaians.
Okay. So in terms of COVID and Healthwise, COVID, since the lockdown has been about a year, 2 years now.
Yeah.
What impact was it to Healthwise in terms of budgetary, money-wise, patients coming in? How are you able to handle it as a CEO?
Right. So COVID has been challenging for every industry, and healthcare wasn't spared. Here at Healthwise, the first thing we needed to do was to ensure that we were ready internally to receive people.
Okay.
So first things first, how do we ensure social distancing in a hospital among our own staff?
Okay.
So we devised a double track system for our staff.
Okay.
We didn't want all staff in the facility at the same time.
Okay, for international viewers, what's a double track system?
So in Ghana, recently our education system realized that our schools were choked. And so our education minister came up with something called a double track system, where half the students are in school at a time, the other half are at home, and then the studying is basically intense for a period. And then they go home and then the next half comes in. So we basically half the staffing, half of them are at work, they do an intense period, go home and then the next half comes in. So that basically cuts down the number of people in the facility. It also cuts down exposure and interaction because these staff have to take public transport to get to work.
True.
So we are basically limiting how many times you have to interact with other people in the public transport system. And it was a system that the staff loved.
Okay.
And even when the waves, the first wave went down, the staff still said we still want this system. We also had to have some staff work from home.
Okay.
Because we were insistent that we are not going to fire.
So you didn't lay off in staff?
We didn't lay off.
Okay, that's
so
impressive.
our accountant still works from home.
He still works from home?
She still works from home.
Balancing books from home?
Oh, yes.
I'm sure he's really happy to be working from home.
I probably see her like once in 2 weeks. And the system has worked. So we realized that internally we have to find different ways of working to be able to stay ahead of this pandemic. And then we had to make changes to, you know, the services that we offer.
Okay.
We realized early on that no private hospital in Tema was offering COVID-19 testing.
Okay.
Now, if you can't test, how do you, manage the situation, public health wise?
Okay.
So people in Tema have to go all the way to Accra to just get a COVID test. They go and queue for hours, come back. It takes them several days to get results. And by the time your results come in, they've gone around spreading it. So very early on, we decided we need to have the capacity to take samples in Tema.
Okay.
And so we started doing our sampling at Healthwise Medical Center. So other hospitals would refer their patients to us.
In Tema?
Yes.
Okay.
We also have a system where we trained other laboratory biomedical scientists in other hospitals and gave them the sampling material. So they would take it and bring it to Healthwise.
Okay.
So that is how we managed to beef up the capacity of testing in Tema.
Okay.
And then as we went on, the next thing to do is, okay, if you can test, then you need to be able to manage.
Exactly.
So very early on, we also started managing COVID-19 cases. We started with managing mild to moderate cases, and then severe cases were referred onwards. So we worked hand in hand with the Metropolitan Health Directorate to ensure that they get our data, and they have been very supportive. So Healthwise played a very critical role in terms of managing COVID-19 here in Tema.
In Tema.
Yes.
Wow, that's interesting. So your hospital was basically one of the first in Tema to start the COVID-19 test?
Yes, we were the first in Tema to actually start COVID-19 sampling, first private hospital.
Okay, so post COVID-19, what has it been? Has the numbers picked up? Are people now coming to the hospital? Because I know initially because of COVID-19, a lot of people are scared to come to the hospitals. Yeah. So have things changed around? Have things basically normalized?
I think that health-seeking behavior changed during COVID. Like you rightly said, people were afraid to come to hospital. They're afraid of taking public transport, and they're also afraid of being told they have COVID-19 when they get to a hospital. But over time, public education has been quite good. So people realize that, if you come in and you are told you have COVID-19, it's not a death sentence. And then if you come in and you don't have COVID, you get managed for whatever it is you have. So yes, patients have started coming back to hospital. Patients are no longer scared of the hospital, I would say. Yes.
So how many departments do you have here?
So we have a nursing department, pharmacy department, laboratory, and then we also have the prescribing department that we call the medical department that has the doctors and the surgeons and the physician assistants. We also have a radiology department for our ultrasound
that's impressive.
and EKGs. Yes.
Okay.
So basically we have 5 departments.
Okay. And your theater can perform basically every surgery?
Yes. So our theater is very well equipped. We have experience with orthopedic surgeries, plastic surgeries, which is quite common actually.
Plastic surgery is common?
Oh yes.
Really? Among the men or women? Say.
Let me not put my sex in a situation. I would say that men and women have different needs when it comes to plastic surgery. Men want things like keloids to be removed, or maybe he has an extra finger and he wants it off, because they attach their looks to their work. Women, our needs are quite different. So both men and women access plastic surgery.
Let me rephrase the question. In terms of percentage, is men, let's say 60% and women 40%? I'm being nice, or is it women being 70% and men being 30%?
I think women generally seek healthcare more than men.
Okay, that answers it. that answers it.
Yes, but we also do obstetrics and gynecological surgeries.
Okay.
And we do general surgeries like hernias and things like that. So our theater is busy.
Okay. All right, guys, you're watching Just for Women Africa. Do not forget to hit the subscribe button. Do not forget to hit the like, leave a comment, and tell a friend who knows a friend about Just for Women Africa. And today we're here in Tema Community 1 at where?
Healthwise Medical Center.
Okay. So now let's talk. You're a female. You're a CEO of a hospital. How come is it that there are a lot more males than females when it comes to being a doctor?
Ghana started focusing on girl-child education, I would say, a bit late in the game. So I remember the Send Your Girl Child to School campaign actually started in the 90s. So men already had a head start when it comes to education and in terms of opportunity to go to medical school. But I believe that a lot has changed since then. My class in medical school had more females than males.
Okay.
And I am told that since then, that has actually been the trend. So there will come a time where you will have more female doctors in Ghana than male doctors, because the trend has changed.
Okay.
So yes, initially being a doctor was a male-dominated thing. Your typical doctor is an elderly man who wears a political suit and looks very distinguished.
Sure.
But I think opportunities have arisen for females, and so we are in the game.
You're in the game. Okay. So tell us. I usually ask every woman who comes on the show this question as we're about to round up. What advice can you give out to women, not just in the medical field, but just in general? What advice can you give to women?
So, my dear woman, I think no matter what you are doing, you're already phenomenal. You are making an impact in the society that is tangible. If you are at home raising a family, you are probably doing the hardest career that is known to man. If you are also out there with a trade or a profession, you are also doing an excellent job and you are making meaningful contribution to society. So for every woman out there, no matter what they are doing, I would say keep on keeping on. Don't give up. You may have challenges in whatever field of endeavor you have chosen, but you can work through the challenges. If it is meant to be yours, you will succeed at it. And I say this also to young children, to young girls all over the country, primary school, JHS, secondary school. You are the future, and the decisions you make today affect the entire country. So if as a young lady you believe you want to become a doctor, an engineer, a seamstress, a hairdresser, I'm a hairdresser as well. I own a salon in Cape Coast.
Wow.
So whatever you want to be, once you are focused, you will become it. It doesn't matter how long it takes. For some people, the journey is straightforward. For some people, they have to go around a bit to get to the end point. But you will get there and you will make it, and you will be the best version of who you are meant to be. So my advice to you is basically, don't give up. You'll get there.
Wow. You heard it from her. Do not give up. Women should not give up. Okay. So basically, what's the plan for Healthwise going forward?
So
what's the future? What's the future?
The future for Healthwise looks great, and I wish as many as possible will come on board. Healthwise wants to be known as an institution that champions occupational health in Ghana. We want to be known as a homegrown institution that is championing something that the society needs. We aim to be your one-stop shop for everything. You know, when you wake up and you are ill and you think of where you want to go, we want you to think of Healthwise. When you want to have your baby and you think, I want to have my baby in the least stressful way, I want you to think of Healthwise. Well, when we look into the future, we are imagining a wide array of things. We like education, and we believe in continuous education. So we want a future where we have opportunity to train the people who have the certificate. You can have a certificate, but you need to be trained on the job. And so we look to postgraduate education. We look to hands-on education. So Healthwise has a bright future, and we look forward to working with stakeholders, the community, private investors, to help us to get there. We also actually dabble a bit in research. Okay. We've actually done some research with the American Osteopathic Society. It was published in the American Journal of Family Health. So we collaborate a lot. You know, it's not just public health. We are also academicians. And so we really look forward to a future where we can collaborate with, you know, academia and public health to get healthcare where it rightfully belongs in Ghana.
In Ghana. Okay, you heard it from her. Okay, well, this is going to be the last question. All right, so if people want to come to Healthwise, they know in Community 1, but can you be specific on how they can actually reach?
Okay, so for the trendy drivers, we are on Google Map. So if you plug in Healthwise Medical Center, you'll get directions to the place.
Okay.
For my less trendy drivers,
okay, we
are, as we said, located in Community 1 on Padmore Street.
Okay.
We are basically in the center of Tema. We share space. We're right across the Tema Metropolitan Assembly. So it's easy for you to get to us that way as well. You can call us. You can call us on 0243 179 453. You can email us at customer.service@hwmcgh.com. You can check out our website, which has lots of information about us, and our website is www.hwmcgh.com. So we also have our Facebook, LinkedIn, Twitter pages. We look forward to seeing you at Healthwise.
Okay, that's nice. Okay, you've heard it all from Dr. Jean Yankson. Okay, do you want to say, tell your clients a Merry Christmas before we go?
Yes, to all stakeholders, all our clients, all my staff, to the community in Tema and Ghana, and to the international community. On behalf of the Board of Directors and Management of Healthwise Medical Center, I wish you a very Merry Christmas. May this season bring you every good thing that you have ever wished for. Thank you very much.
Okay guys, you heard it all from Dr. Yankson from Healthwise here at Community 1. You've been watching Just Women Africa show. Do not forget to hit the subscribe button. Do not forget to leave a comment. Do not forget to tell a friend who knows a friend about Just Women Africa. Until the next show, it's bye. Merry Christmas. Thank you very much.
Thank you too.